drug abuse prevention and control. When we say drugs, these are the substances that change a person's mental or physical state. They can affect the way your brain works, how you feel and behave, your understanding, and your senses. This makes them unpredictable and dangerous, especially for young people. The effects of drugs are different for each person and drugs. Here are some examples of different kinds of drugs and their definitions.
Hello, I am Gamer Patano and I'm about to discuss regarding the new psychoactive drugs. New psychoactive substances or NPS are compounds that mimic both licit and illicit drugs, and these substances are being discovered each year through forensic toxicology. Ang psychoactive drug daw po ay ang binagong ibang compound nito o nilalaman nito parehas ng pinagbabawal at hindi pinagbabawal na drugs. At ang substances na ito ay discover ng forensic toxicology. New psychoactive drugs. New psychoactive substances or NPS, as I said a while ago, are a range of drugs that have been designed to establish drugs such as cannabis, cocaine, MDMA, and LSD, whilst remaining legal their previous name legal highs. Ginawa ang psychoactive drugs para gayahin ang mga drugs gaya ng marijuana, hemp, cocaine, LSD. However, manufacturers of these drugs develop new chemicals to replace those that are banned, which means that the chemical structures of the drugs are constantly changing to try to stay ahead of the law. Kada taon, pinapalitan ng manufacturers ng new psychoactive drugs ng ibang chemical para makasabay sa batas. Dahil ito nga ay isang psychoactive drugs. And some of its contain have been mimicked and changed. New psychoactive drugs are substances also known as colloquially as mushroom, are substances that mimic the effects of other class A controlled drugs such as cannabis, cocaine, and ecstasy, are produced by introducing slight modification to the chemical structures of controlled drugs. Example of psychoactive substances are including alcohol, caffeine. Yes, caffeine are also psychoactive drugs because it causes us to be high. And also the nicotine from the cigarette, it also contains psychoactive ingredient or substances. Marijuana, of course. Marijuana is one of the psychoactive drugs because it contains THC or tetrahydrocannabinol, which is more than 3% that causes people to be high. It is also associated with marijuana. And certain pain medicines, yes, painkiller drugs are also psychoactive substances. It also contains some of its substances. Many illegal drugs such as heroin, LSD, and methamphetamine hydrochloride or ang pinagbabawal na gamot are also psychoactive substances. And that's all for my part. Thank you for listening. Cannabis. People often use the word cannabis and marijuana interchangeably, but they don't mean exactly the same thing. The word cannabis refers to all product derived from the plant's cannabis sativa. The cannabis plant contains about 540 chemical substances. The word marijuana refers to the parts of or products from the plant cannabis sativa that contain substantial amount of tetrahydrocannabinol or THC. THC is the substance that primarily responsible for the effect of marijuana on a person's mental state, and some cannabis plants contains very or just a little amount of THC. The difference between CBD and THC is CBD typically does not have psychoactive effect. In other words, it won't cause you to get high. While THC, on the other hand, it does have psychoactive effect. It is the substance that produces the high that causes people to get high. It is also associated with marijuana. The different cannabis species, hemp, higher CBD and THC, less than 0.3%, longer grow period. It is legal in many countries. Medicinal, it is using for medicinal use. Industrial uses, it is associated with CBD. CBD is used to cure seizures, inflammation, pain, mental disorders, anxiety, and even depression. While marijuana, it contains higher THC. THC is 5 to 25%. It is shorter grow period. It is legal in few countries. It is used for medicine or for medication. Recreational uses. It contains THC. It is used to cure glaucoma. Glaucoma is the disease that which the person have this kind of visual loss, low appetite, insomnia. When a person experience shift in sleep pattern, the person having difficulty in sleeping at night, nauseous and anxiety. THC reacts on specific brain cell receptors that ordinarily react to natural THC like chemical. This causes the high that people who are using it. Ang THC daw ay nagre-react sa brain cell receptors at ito ay nagtuturo para maging high ang people na nagamit nito. Based on the articles that I have read, on the reliable studies that I have read, it's shown that CBD may help reduce chronic pain by affecting endocannabinoid receptor activity, reducing inflammation, pamamaga, and interacting with neurotransmitters. Some research suggests that CBD may be effective for certain types of pain and back pain when used on its own.
Heroin. Heroin is an opioid drug made from morphine, a natural substance taken from the seed pod of various opium poppy plant. This opium poppy plant is a species of flowering plant in the family of Papacyverse. These plants grown in Southeast and Southwest Asia. Heroin can be a white or brown powder or a black sticky substance also known as black tar heroin. Heroin is also belongs to a group of pain reliever drugs called narcotics. How heroin use? Heroin can be inject, sniff, snort, or smoke. Some people mix heroin with crack cocaine. This practice called speedballing. Effects of heroin. Heroin enters the brains rapidly and binds the opioid receptor on cells located in many areas, especially those involved in feelings, pain, and pleasure, and in controlling heart rate, sleeping, and breathing. Heroin provides a burst or rush of good feelings, and the user feels high and relaxed. Taking an overdose of heroin can cause a person or a user stop breathing or die.
Good day, I am Trix De La Cruz, and for today's topic, I will discuss all about cocaine. Cocaine is a powerfully addictive stimulant drug made from the leaves of the coca plant native to South America. Although healthcare providers can use it for valid medical purposes, such as local anesthesia for some surgeries or recreational, cocaine is illegal. As a street drug, cocaine looks like a fine, white, crystal powder. Street dealers often mix it with things like cornstarch, talcum powder, or flour to increase profits. They also mix it with other drugs such as stimulant amphetamine or synthetic opioids, including fentanyl. Adding synthetic opioids to cocaine is especially risky when people using cocaine don't realize it contains this dangerous addictive. So ano nga ba yung cocaine? So yung salitang cocaine, tumutukoy siya sa drogang nasa pulbos o malakristal na anyo. Ang powder ay kadalasan ding inihahalo sa bagay tulad ng gawgaw, powder, or asukal. Yung cocaine is hinango siya mula sa dahon ng coca mula sa South America. Ang cocaine ay unang ginawa bilang painkiller lamang, pero kadalasan is sinisinghot din ito. And base sa healthcare providers, ang cocaine ay pwede lamang gamitin for valid medical purposes only. So, paano nga ba natin malalaman kung illegal na ang paggamit ng cocaine? So, ang masasabi lamang natin na illegal na yung paggamit ng cocaine kung ang isang tao ay ginagawang libangan yung cocaine. And also, we have short-term effects of cocaine it may include extreme sensitivity to touch, sound, and sight, intense happiness, anger or irritability, and decreased appetite. And people who use cocaine often may also have more serious side effects and health problems like headaches, convulsions and seizures, heart disease, heart attack, and stroke, mood problems, sexual trouble, and lung damage.
Alcohol. Alcohol is sometimes referred to the chemical ethanol. It is the present drug that is active ingredients in drinks such as beer, wine, and distilled spirit. It is one of the oldest and most commonly consumed recreational drugs, causing the characteristics effects of alcohol intoxication. Among other effects, alcohol produces happiness and euphoria, decreased anxiety, increased sociability, sedation, impairment of cognitive and memory motor, and sensory function, and generalized depression of central nervous system function.
Amphetamines. Amphetamine sulfate or yung tinatawag din speed is also used for recreational and non-medical purposes. It can lead to euphoria. It suppresses the appetite, now which can lead to weight loss. Used outside the medical context, stimulants can have severe adverse effects, which are heart problems na maaari mag-cause ng cardiac failure or heart attack, memory loss, and stroke. Actually, inirereseta ng doktor ang amphetamines to treat conditions such as attention deficit hyperactivity disorder o yung tinatawag din na ADHD, and also narcolepsy kung saan naman yung isang tao ay may uncontrollable urge to sleep. Ginagamit din siya to treat Parkinson's disease. Paano naman ginagamit ang amphetamines? It generally swallowed, injected, or smoked. They are also snorted. In addition, in low doses naman, amphetamines have been used to treat depression, especially sa mga patient na may low energy, decreased attention, and hypersomnia. Pero ang paulit-ulit na paggamit ng amphetamines ay maaaring mag-trigger ng psychostimulant abuse In addition, in low doses naman, amphetamines have been used to treat depression, especially sa mga patients na may low energy, decreased attention, and hypersomnia. Pero ang paulit-ulit na paggamit ng amphetamines ay maaaring mag-trigger ng psychostimulant abuse symptoms and any type of depression that is resistant to antidepressants. Ecstasy. Ecstasy, or also known as MDMA, is a type of a stimulant drug na maaaring mag-cause ng hallucinations. Kilala rin siya as a designer drug because it was created for the purpose of making someone feel high. The drug is also popular with teens and young adults who go to clubs, concerts, or rave parties. Ang ecstasy ay both hallucinogenic and stimulant drug. It makes the user experience a rush of good feelings and makes feelings much more intense whether they are good or bad. The drug's effects usually last up to 6 hours. Ecstasy can be dangerous if it's mixed with other drugs including alcohol, cocaine, amphetamines, ice, and some prescription medications tulad na ng antidepressants. At sa mga tao naman na may certain conditions such as epilepsy, high blood pressure, heart disease, diabetes, kidney disease, or mood and At sa mga tao naman na may certain conditions such as epilepsy, high blood pressure, heart disease, diabetes, kidney disease, or mood or psychiatric disorder, they are at greater risk of harm. Sa mga tao naman na may certain conditions such as epilepsy, high blood pressure, heart disease, diabetes, kidney disease, or mood or psychiatric disorder, they are at greater risk of harm if they take ecstasy. Ecstasy is sometimes called XTC, X, Adam, E, Roll, A, 007, and Molly. Paano ginagamit ang ecstasy? Ecstasy can be swallowed by pill or tablet or snorted. Hallucinogens. The term hallucinogens refer to many different drugs na kadalasan tinatawag na psychedelic drugs since it changes the person's perception of reality. Being under the influence of hallucinogens, it's commonly called tripping. While the effects of these drugs are very widely, all change the way people see, hear, taste, smell, or feel and affect mood and thought. Sa mataas na doses naman, all may cause a person to hallucinate or see, hear, and feel things na wala naman talaga daan. Some hallucinogens are being studied for possible therapeutic benefits in treating mental disorders such as depression. Hallucinogens are split into two categories. It is the classic hallucinogens such as LSD, na ito ay isang powerful drug, typically small squares of floating paper or gelatin are soaked in LSD, which are then swallowed, although it may also come in tablets or capsules. And the second one is dissociative drugs such as PCP, that is usually comes in the form of tablets, capsules, or powder of various colors. It's usually swallowed, sniffed, or injected, but is sometimes smoked. And lastly, hallucinogens can be man-made, or they can come from plants or mushroom or extracts from plant and mushrooms. Some common short terms of hallucinogens are anxiety or panic, changes in appetite, changes in the perception of time, increased heart rate, and paranoia.
Steroid. A steroid is a biologically active organic compound with four rings arranged in a specific molecular configuration. Steroids have two principal biological functions as important components of cell membranes that alter membrane fluidity and as signaling molecules. Hundreds of steroids are found in plants, animals, and fungi. All steroids are manufactured in cell from the sterols. Lanosterol or cycloartenol plants. Lanostenol and cycloartenol are derived from the sigilization of the terpenes squalene. The steroid core structure is typically composed of 17 carbon atoms bounded in four fused rings, three six-member cyclohexane rings, rings A, B, and C in the first illustration, and one five-member cycloprotein rings, the D rings. Steroids vary by the functional groups attracted attack attract to this four-ring score, and by the oxidation states of the rings. Sterols are forms of steroids with a hydroxy group of position position 3 and a skeleton derived from collagen. Steroids can also be more radically modified, such by changes to the ring structure. For example, cutting one of the rings, cutting ring B, produce corticosteroid, one of which is a vitamin D. Thank you.